Why do babies have soft spots on their heads? So, soft spots are just gaps that are left in the skull to allow the baby's bones to fuse together as they grow. It also allows for easier passage through the pelvis when the baby is being born vaginally. Now, babies have two soft spots. They have an anterior soft spot and a posterior soft spot. Now, the proper term for these soft spots is fontanelles. So we have an anterior fontanelle, which sits just here on the front of the baby. It's usually like a diamond shape. And then we have a posterior fontanelle that sits right here at the back. So the front fontanelle here usually closes when the baby's around about 18 months, and this back one here usually closes up a lot earlier, actually, around about that 3 months of age. So fontanelles are actually quite good from an assessment point of view for a baby, because when you look at the fontanelles, they should be you should be able to see that there is a little bit of, you can press it and it will come back up, and there's a little bit of room for movement there. But if it's a bulging fontanelle, that's really not a good sign in a baby. And a sunken fontanelle usually tells us that the baby is a little bit dehydrated. So, quite clever little aspects of the baby's skull. And like I said, both should be closed up by around about 18 months of age.